In modern medicine, there is essential to have relevant imaginary examination combined with the clinical examination too, to diagnose diseases and to see the results, for example, from the trauma. But is the magnetic resonance imaging always that good? Nobody cannot run away from the changes ourselves from the aging. If people have grey hair or wrinkles, we cannot say that person has pain. Everybody gets those stuff from the aging, so how common is different findings in MRI also in non-painful group? We will going to find it out now. Horga et al. In 2020 had clients aged from 25 to 73. He examined 230 knees without pain in MRIs and found that 97% of the clients had at least one abnormal finding in the results of the pictures. What were those abnormal findings? In that population, there was meniscus tear in 30% of the population, changes in cartilage with 62% of the population, changes in bone structures 52%, changes in tendon tissue were present in 46% of the population, and the ligament change were present in 38%. All knees without pain. How about leg length difference? Do they matter concerning about the pain, and how typical finding is it? Knutson 2005 had study about this, and he found out that clinically meaningful difference between the legs are more than 20 millimeters. In these studies, 90% of the persons has some sort of leg length difference, and the mean magnitude of difference was 5.2 millimeters. So in most of the cases, don't stress if you have been told that you have a leg length difference. That is quite typical in most of the people. How about sounds in the knee joint during the movement? Is it bad or not? Robertson et al. Published paper 2017, and the focus on that was to find out about clients' belief with the knee sound and does it correlate with the pain. In that paper they found that in 99% of the cases sounds were not alarming sign as long there were no pain present, and the acoustic stuff in the knee is not indicator to have knee issues in the future. Joints pop and they have these sounds. It's not that meaningful when there is no pain present. Hopefully Mick got those. Barreto et al. Published nice and informative study about the unilateral shoulder pain. For the research, he had 123 patients with pain on the one side and the opposite side was pain-free. When researchers checked how many rotator cuff tendinopathy findings was in the painful side, the result was that in 90% of the population who attended this search, they had changes in the tendons. When they checked non-painful side, there was finding about tendinopathy also in 89% of the pain-free shoulders. Here is an acromion, and underneath there is quite common stuff to have some fluids. But when we go for the underneath the structures, and when there was pain present on that side, in 55% there was this liquid underneath the acromion. And when they checked the opposite side, there was liquids present in 56% of the population. Sääksjärvi et al. 2020 had nice study about prospective study about low back pain. 75 persons who attended to the study were at their 20s and they were serving at the military. Because of the back pain, they were not able to continue in the military, but they still attend to this study. All persons had MRIs and filled up the forms about the pain and disability. After 30 years, 69 persons were contacted and the 35% filled up the similar questionnaires. After that, 26 persons went to MRIs. The conclusion in this study was that degenerative changes were not predictors for the future back pain or disability. The problem of that study were that the researchers only had the numbers about the signal strength and the examination population was quite small. So don't worry with the changes in the lower back. And what is common? Brinjikji et al. 2015 had this lovely study about the lumbar area MRIs. In asymptomatic population had intervertebral disc degeneration in 37% in a population when they were at the 20s. When they checked group at their 50s, there was in 80% of the disc generation present. Intervertebral disc bulges were also quite normal finding. These bulges were present in 37% cases in the people when they were at the 20s, and when they were at the 50s there were bulges present in 60% of the population. If we think about the traumas, then the MRI is example excellent way to find out what is broken and how the treatment continues. If there is no trauma on the background, in low back cases it's important to find out is there bad pathologies on the background, cancers, systematic inflammation, diseases, infections and fractures. In those cases, patients need to have medical attention. If there is a big neurologic issue, motoric issue and stuff like that, then the finding out the current situation is valuable information. For example, when we take low back cases, the bad pathologies and big neurologic issues covers about 10% of the population in low back cases. How about the rest? Well, the rest 90% is this non-specific low back pain. And in that kind of cases, you need to find out what is the current pain mechanism on the background. If you want to find out what kind of different pain mechanism is present, then you can check the suggested video. And in that cases, when there is non-specific low back pain, the imaginary stuff, for example MRIs, might take the direction to wrong, because if the picture is taken too early, when it's spoken out to client in bad way and the client think that okay, he or she is broken, he cannot be fixed, that is vicious circle. We don't want to go in that. This kind of fun stuff this evening. Hopefully you find this video informative. Hit the thumbs up, comment down below and subscribe to the channel. There is plenty stuff coming.